Hi, good morning, everybody. Thanks for coming. And thank you, Gretchen, for the introduction. So as you can see on this helpful slide, I am going to be talking about an approach to maximizing the impact of taxpayer dollars. So this slide uses the term outcome-based, and I'm going to use probably throughout my presentation the term evidence-based or evidence-based policy, but largely to mean the same thing. I'm going to talk about why it's important for us to identify more programs and strategies that have strong evidence of effectiveness in improving important outcomes, like some of the outcomes you heard in the earlier speeches today. And over the course of my presentation, I want to cover a few topics today. First, I want to go through the rationale for evidence-based policy. Why is it that outcomes measurement and rigorous evaluation are so important for improving the effectiveness and the efficiency of government? I want to talk about some key evidence-based reforms that have gone forward over the past several years. And then I also want to talk about what we mean by rigorous evidence and what kind of evidence is needed, what kinds of evaluations are needed to build that kind of evidence, so we really find out what works and what doesn't. And finally, I'm going to close with a few suggestions on concrete strategies for building and using rigorous evidence of effectiveness. So you already heard a bit about the Laura and John Arnold Foundation. I think Gretchen gave a good introduction to sort of our priorities. To boil it all down to one sentence, we're trying to improve the effectiveness of social spending through the broader use of rigorous evidence about what works. And this is true across many different fields. We're sort of interested in all areas of policy. But I want to start out my presentation by talking about why we think this is important, why evidence-based policy is sort of a key to sparking rapid progress in addressing a lot of long-standing problems. And the problem that evidence-based policy seeks to address is that often U.S. social programs do not produce their desired results. So for most large federal social programs, which is, we largely work in the federal space, but also increasingly in the state and local space, but in the federal government, and I think this is true at the state level as well, a lot of federal social programs such as Head Start or Job Corps largely operate like faucets. In these programs, Congress directs agencies to allocate large streams of funding to state and local organizations, often by formula, sometimes by competition, but where rigorous evidence of effectiveness doesn't really play much of a role in what gets funded. Now, the problem with that approach is that there have been a number of rigorous evaluations over recent years to show that it falls short in improving people's lives. Specifically, since 1990, there have been 11 instances where large federal funding streams like a Head Start or Job Corps have been evaluated in well-conducted randomized controlled trials, which, as I'll talk about later, when they're feasible, they're generally considered the best method for measuring a program's impact. And in 11 of those studies, or in 10 of those 11 studies, the program being evaluated was found to have small or weak or no effects on the outcomes that it was trying to improve. Now, in other words, those who were not enrolled in the program were doing about as well as those who were enrolled, based on the study. So one important note I want to make here is that that doesn't mean that every grantee within these programs is ineffective. Within Head Start, there are likely a lot of effective Head Start centers. But what these evaluations did was they measured the average effect of the program across all grantees. So the effective grantees were likely diluted out by all of the grantees that were ineffective. I know this is sort of a downer way to start off a presentation. I'm going to get to some more positive stuff here in a second, I promise. But we're gonna be a little dark here for a little bit longer. I'm sorry. So meanwhile, while some of these programs are underperforming, we haven't seen a lot of progress in addressing some of our biggest social problems. The U.S. poverty rate currently stands at about 14.5% and has shown little overall change since the 1970s. And this is true both using the official poverty measure as well as an alternative National Academy of Sciences measure. The general pattern is that we haven't seen a lot of improvement. You see a pretty flat line there on the bottom graph. There's a similar story in education. So reading and math achievement for 17-year-olds, the end product of our K-12 education system, is virtually unchanged over 40 years, according to the respected National Assessment of Educational Progress long-term trend. And this is in spite of an increase of about 90% in per-student funding over the same time period. But perhaps most striking is that average yearly income for the bottom 40% of U.S. households is almost unchanged since the 1970s after you adjust for inflation, and this is according to Census Bureau data. Now, I don't want to overstate this case. We have made important progress in a number of key areas. We've seen reductions in teen pregnancy. Over the past several decades, we've seen reductions in violent crime. But still, it's hard to escape the conclusion that for a long period of time, in spite of spending a lot of money and trying a lot of things, we haven't seen a lot of progress in addressing many of our longstanding social problems. So what I want to suggest is that there's a different, much more effective way forward with a key role for government, but not through its traditional approach to social spending. Evidence-based social spending, I'll suggest, could bring rapid progress to social policy in the same way that evidence-based medicine has brought progress to medicine and health over the past half century. And the reason can best be illustrated with a couple quick examples. So the first example I want to talk about today comes from the 1980s. In the 1980s, the Department of Labor launched a pilot program which was designed to subsidize employers who hired disadvantaged workers, such as welfare recipients. The way it worked was that the workers were given a voucher worth several $1,000s that they could present to a potential employer, and if the employer hired the worker, they could cash the voucher. So it was a financial incentive for them to hire these folks. Now, importantly, this pilot program was set up as a rigorous, randomized experiment in which some workers were randomly assigned to receive the vouchers. Some were assigned to a control group that didn't receive them. And at the end of the study, what the researchers found was that those individuals in the control group, so those who didn't receive the vouchers, were actually 60% more likely to have landed a job than those who had received the vouchers. So the program completely backfired. Does anybody have a guess as to why that might have happened?
Nobody wanted to hire people who had the vouchers. It was more trouble than it was worth.
Yeah, you're basically on point. One of the things the researchers speculated about was that the vouchers had stigmatized the workers in the eyes of their potential employers, who saw them as sort of hopeless cases that needed a government subsidy to get a job. So that's the first thing that rigorous evaluations can usefully do. They can identify those things that you think ought to work. They may be backed by preliminary evidence. They may be backed by expert opinion, or in this case, economic theory, but turn out not to work when tested in the real world in a rigorous way for reasons that you hadn't foreseen. This slide just shows you one other sort of concrete example where rigorous evaluations have shown an idea that was thought to be promising to be basically ineffective. I'm sure many of you guys know the DARE program from the bumper stickers and the T-shirts. It's actually been subjected to a couple well-conducted randomized trials and found to produce no effects on youth substance use. So that's sort of the disappointing news that rigorous evaluations can provide. It's useful news because it tells us, things that we might want to move away from. But now I want to move on to the good news. So this is where things get a little bit more positive in the presentation. So I want to give you a couple examples of where rigorous evaluations have identified programs that have worked in a big way, have really meaningfully improved important outcomes. So this first example I'll talk about is the Reemployment and Eligibility Assessment Program. So this is a mandatory program in many states for unemployment insurance claimants who are deemed likely to exhaust their benefits. The program is delivered by a trained interviewer at Department of Labor one-stop centers and basically assesses whether or not they really are eligible for their benefits. It provides them with job market information, and it also helps them develop a reemployment plan, which includes referring them to reemployment services such as job search assistance or resume assistance, and then also refers them to training if they need that. Now, this program was evaluated in a large, well-conducted randomized controlled trial across 4 states, and it was found to overall reduce unemployment insurance receipt, so it was savings to the government. But the effects were particularly large in Nevada, so I'm going to focus on those. And the researchers speculated that one of the reasons Nevada had such a large effect was that it was a very streamlined program. So the same person who was doing the eligibility assessment also provided the reemployment services, whereas in other states, people were referred, across town or to another office to get their reemployment services. So this was a very streamlined program. So in Nevada, this was tested in a very large trial in which 33,000 people were randomly assigned either to receive the assessment or a control group that received just usual services. And what the study found over an 18 to 26-month follow-up was that it produced large net savings to the government of about $715 per claimant, which adds up to millions and millions of dollars in savings. And at the same time, importantly, it actually increased earnings for the claimants themselves. So it wasn't just the government saving money for the government. It improved the economic well-being of the people going through the program. So that's the second thing that rigorous evaluations can usefully do. They can identify things that work in a big way, that really move the needle on important outcomes. Now, I'm guessing that many of you, when you heard about that study, thought, it would be great if we could do a study along those lines, but it had to have cost millions of dollars to do. Well, actually, this study, even though it was a very large, like I said, 33,000 people randomly assigned, they did follow-ups at 12 months and 2 years, the total cost of the study was $200,000, which when it found a program could save the state millions of dollars, you're talking about a really great return on investment for this evaluation. So at the end of my presentation, I'm going to talk a bit about how rigorous evaluations like these can be done at low to moderate cost. So I want to just give you one more positive example. This is the H&R Block College Financial Aid Application Assistance Program. This is another sort of an area where you're creating efficiencies. So I'm guessing that many of you have some personal experience with the federal financial aid form, the FAFSA form, and know that it's a pretty unwieldy thing. Multiple pages long, dozens of questions you have to answer. It typically takes several hours to complete. So what some researchers did was they teamed up with H&R Block to see if they could really streamline this process. So essentially what happened was if a low-income family came in to get their taxes prepared, and they had a child of college age, the H&R Block associate would use their tax data to pre-populate their FAFSA form, and then if the family agreed, they would electronically submit the form to the Department of Education. So it took a multiple-hour process, and it boiled it down to about 15 minutes. So this program, again, was evaluated in a very large, rigorous, randomized experiment. 26,000 families were randomly assigned either to get this assistance or to get H&R Block's usual services. And at a 4-year follow-up, it was found to increase college enrollment among low and moderate income students by 29% compared to a control group, which means that we now have a proven, replicable way to produce an increase in college enrollment by low-income students that's of national importance. And again, this study was done at much lower cost than you might imagine. Tracking kids over 4 years, 26,000 people, and the total cost of the study was about $150,000. And again, I'll get back to how that's possible at the end of the presentation. Now, in the field in medicine, a pharmaceutical drug or medical device that's backed by the kind of evidence I was just talking about is put into widespread use because the system is set up to reward evidence of effectiveness. The Food and Drug Administration specifically requires such evidence before licensing a drug or a device for market. Licensing then signals healthcare providers and patients that effectiveness has been established, and then that spurs demand for the device or the drug. In social policy, by contrast, scientific evidence plays little role in deciding what gets funded. As I mentioned earlier, lots of programs operate sort of as faucets, where evidence of effectiveness has little say in what gets funded. Thus, activities with strong evidence of effectiveness, like the FAFSA example I just mentioned, never really get funding and they never scale up, and that's actually been the case with that intervention. It's sort of just sitting there on the shelf waiting to be used. So evidence-based policy seeks to change that dynamic. Two key goals of evidence-based policymaking are shown here. So the first is to increase funding for rigorous evaluations so you can increase the number of research-proven programs that policymakers and practitioners can choose from. And then the second goal is to create strong incentives for people to use these research-proven programs, so create financial incentives within funding programs for people to adopt and faithfully implement them. And we believe that if you could do these two things, you could have an enormous impact in improving the effectiveness of government and improving people's lives. And these core concepts, we're happy to say, have been incorporated into a number of initiatives over the past several years, which I'm going to talk about in the next segment. Recent developments in Congress and the federal agencies. So we've covered the faucet. So there have been 7 evidence-based initiatives launched over the past several years in a wide variety of policy areas: early childhood home visitation, teen pregnancy prevention, K-12 education, workforce development, and other areas. And what makes these programs evidence-based is they really sort of bake the idea of using rigorous evaluation and building evidence into sort of the DNA of the programs. These are core functions of the programs. So all of these programs have a similar funding pattern. They use a tiered funding structure, which I'll talk about. Some of these programs have 2 tiers, some have 3, but the basic principles are the same, and so I'll use an illustrative example. The Investing in Innovation Fund, the I3 program at the Department of Education. So in its top tier, I3 makes its biggest grants to programs that already have strong evidence of effectiveness, And the money goes towards scaling up these programs on a wider scale and then rigorously evaluating to make sure that they actually still work when you scale them up. So an example of a program that's been funded through this top tier is Success for All, which is a school-wide reform program for high-poverty schools. It's found in a large, well-conducted randomized trial to produce 25 to 30% increases in reading achievement at the second grade over a 3-year period. So that's an example of what's funded in the top tier. The next tier down, the validation tier, provides more modest grants for studies that have sort of moderate evidence of effectiveness. They've been studied some, but it's not quite to the level of rigor that, like Success for All that I just mentioned. And the idea here is that these programs get some money for operations, but they also get money to do a rigorous evaluation so they can move into that top tier. And then finally on the bottom there are development grants, and these are sort of funding promising ideas, but also doing a credible evaluation to see if they're working in their initial stages. So this tiered structure has sometimes been described as a conveyor belt, funding innovation and evidence building in its lower tiers so as to grow the number of proven effective programs that can qualify for top tier funding and then large scale implementation. And at the Arnold Foundation, our team is actually adopting some of these key features in how we're giving out money as well. We want to have sort of this tiered funding structure where we're funding innovation in these lower tiers, getting some good new ideas, but also rewarding programs that have strong effects. And we think this could be a model that could be adopted in states, just as it's been done in the federal government potentially. So the last part of this section, I just want to make a point that there's a pretty broad bipartisan support for this evidence-based approach to policymaking. And while the programs that I mentioned on the previous slides were created during the Obama administration, the first evidence-based program was actually created during the Bush administration. It was focused on funding evidence-based home visitation programs. And now there are a number of bills moving through Congress that also have strong evidence and evaluation requirements. I've listed a few examples here. The first one is part of the Senate reauthorization of the big Elementary and Secondary Education Act, so the big federal education bill that's before Congress. And essentially what it would do is it would broaden the use of evidence-based approaches across the Department of Education and really focusing on finding field-generated ideas, so ideas coming out of practitioners and school districts as opposed to a top-down approach, and figuring out which of those ideas are the most effective and most efficient and rigorously evaluating them and hopefully scaling them up over time. That bill was sponsored by, among other people, Senator Hatch of Utah. Another example is legislation to establish a federal evidence-based policy commission. This was put forth by Representative Paul Ryan and Senator Patty Murray. And among other things, this commission is going to be responsible for making recommendations on how best to incorporate outcome measurement and rigorous impact analysis in program design across the federal government. And this bill has actually already passed the House and is expected to pass the Senate. And then finally, I'll just touch on one last example, social impact bond legislation. I know there are a couple of social impact bonds going on in the state here. And so there's a bill before Congress that would create a fund to scale up the use of this model. And for those of you who aren't familiar, essentially the way it works is that under a social impact bond, investors take on the initial risk of funding a program, and they're only paid back by the government if the program achieves a certain set of pre-specified outcomes. And so this bill would set up a fund to do this across the country, and it has very strong evaluation provisions in it to make sure that the programs being funded in this way are actually effective and are actually responsible for the outcomes that are observed. So it's an exciting time for evidence-based policy. We've seen a lot of reforms moving forward. There's certainly more work to do, but I think the momentum is there on both sides of the aisle to do more of this stuff. So I've been using the term evidence-based a lot so far. So what kinds of evidence are needed to increase government effectiveness? Now to start out this section, I want to be clear that we believe that many types of evaluation and research are needed to build evidence and learn about what works. This includes many different types of research and evaluation design. So it includes implementation studies, find out whether or not a program is being operated in the way that it was intended to. Because if it's not being implemented well, you really don't have much chance of achieving an impact on an outcome. In addition to implementation studies, it includes sort of preliminary randomized or non-randomized studies to identify promising programs that merit more rigorous evaluation. And in fact, we generally recommend that funders only launch large randomized evaluations like I talked about in some of the examples earlier in the presentation, after an intervention has been found to have very promising effects in preliminary studies. So we advocate many different types of research and evaluation, but a central theme of our advocacy is that when they're feasible, well-conducted randomized controlled trials should be considered the strongest method for measuring a program's impact. And it's not just us saying it. This is consistent with the evidence standards articulated by a lot of respected research agencies, including the Institute of Education Sciences at the Department of Education, Food and Drug Administration, and others. But why? What makes randomized controlled trials special in terms of measuring a program's impact? Well, it all boils down to the process of random assignment. So in a randomized controlled trial, some of you may be familiar with this, you randomly assign a sizable number of individuals either to a treatment group that receives a new program, a new service, or a control group that receives usual services. That process of random assignment ensures to a high degree of confidence that there are no differences between those two groups, except for one. The program group gets the new service and the control group does not. So as a result, when you track outcomes for those two groups over time, you can confidently attribute any differences in the outcomes, whether it's earnings or reading achievement. You can attribute those differences to the program and not to any other factors. And an important feature of random assignment is it ensures that the two groups are equivalent not just on things you can see, like ethnicity or income levels, but on things that you can't see or really readily measure, like motivation and psychological resilience. Now, this is important because, in contrast, studies that compare program participants to non-participants using methods other than random assignment always carry an element of uncertainty about whether you've got two groups that are equivalent, especially on those unobservable characteristics. It's really hard to see whether you have two groups that are equivalent on motivation. So what we see a lot in the evaluation literature are studies where a program is evaluated and they compare people who signed up for the program, showed a certain level of motivation to improve their situation, and they compare them to a comparison group that had the opportunity to sign up but didn't. And then at the end of the study, they inevitably find the program is really successful because they can't really tease apart whether or not the program was effective or it was just these people were more motivated and they were going to improve their outcomes no matter what. So that's sort of the key to random assignment is you have assurance that the two groups are equivalent that you're comparing. Now, when randomized controlled trials aren't feasible, a good second best alternative are studies that compare program participants to an observably equivalent group of non-participants. These are sometimes called well-matched comparison group studies, quasi-experimental studies. Now, I'll skip over this study in the interest of time. I can come back to it if anyone's interested, but it goes through some of the key things that you need to get right to have a rigorous comparison group study. But basically, if you're looking at a randomized controlled trial or a comparison group study, the level of rigor all boils down to one word: equivalence. To have a rigorous impact estimate, to estimate the impact of a program on a certain outcome, you need to have two groups, a treatment group on one hand and a control or comparison group on the other hand, that are highly similar in key characteristics, because that allows you to rule out all sorts of alternative explanations for any differences in outcomes that you observe over the course of the study. Now, below these more rigorous designs lie a number of common, less rigorous designs. They include randomized trials with key limitations, so studies that are very small. If you randomly assign 30 people, you're not really going to find out a whole lot. They include comparison group studies in which groups are not equivalent in key characteristics. And so you're sort of comparing apples to oranges, so you really can't isolate the effect of a program. They include pre-post studies. So an example of a pre-post study would be looking at a workforce training program and seeing if participants' earnings were better after participating in the program than they were before. And then finally, you have outcome metrics. So an example of an outcome metric is maybe a youth program will say 70% of the youth who went through our program went on to college. Well, in a vacuum, that sounds great. But if you don't have a control group or comparison group, you really don't know if that's good. What if the program was distracting them from their studies, and if they hadn't been going, 80% of them would have gone to college? You just don't know without an equivalent comparison group. So one thing that's not widely recognized is that these less rigorous designs probably comprise about 90% or more of the evaluations that are done across government. And I want to be clear that these play an important role in building evidence about what works. They can be valuable for identifying promising programs and in generating hypotheses about what might work in addressing important problems. And so they play an important role as part of a larger research agenda. But what's not widely appreciated in the research and policy community is that too often promising findings from these types of studies are not confirmed when a more definitive, rigorous evaluation is done. And this is true across pretty much all fields where rigorous evaluations are conducted. In medicine even, 50 to 80% of interventions that are found promising in phase 2, mostly non-randomized studies, are found to be ineffective when they get to a more rigorous phase 3 randomized trial. There's a lot of sort of fall-off between those two stages. Similar story in K through 12 education. The Department of Education's Institute of Education Sciences, its research arm, has done well-conducted randomized trials. Oh, that slide needs to be updated. Of about 90 interventions. The RCTs that were well-conducted were of 90 interventions, so not the 115 there. But the pattern was basically the same. In 90% of the studies that they did, the programs were found to have weak or no effects on key educational outcomes. And this was true even for programs that everybody thought were going to work. They included award-winning educational software programs. They included programs that embodied all of the recommendations of the prestigious National Reading Panel. These were things that people thought were going to work. And the same pattern has been seen in other areas like workforce development, crime, and even business. So a key thing to take away from this is that this is sort of a symptom of the way that our world works, I think. We have a lot of challenging programs that we're trying to solve, and we should probably expect that a lot of the things that we try aren't going to work. So I don't think those statistics should really be depressing to us. They shouldn't discourage us, but they should just indicate that we need to be humble about how much we know and how much more we still have to learn and why we need to do more rigorous evaluations of what we're doing in the field so we can find out what are the specific things that really can improve outcomes. So I want to close out this section of the presentation with just sort of an intuitive example to illustrate why less rigorous evaluation designs can often produce the wrong answer. So what you see here are the results of a randomized controlled trial of the Comprehensive Child Development Program. So this was a home visitation program operated in the 1990s by the Federal Department of Health and Human Services. It served low-income families who were in poverty and who had a newborn child. And what you see on the slide here, represented by the solid dark line, is sort of the trend in employment rates for the women who went through the program. And as you can see, they saw a big increase over a 5-year period in their employment rates. It more than doubled. But importantly, this was a randomized controlled trial, so some women were randomly assigned to a control group that didn't receive the program and just received other services available in the community. They're represented by the dotted line, and they saw the identical rise in their employment rates. So the key thing, so basically the rigorous evaluation found that this program was ineffective in improving employment. But the key thing to take away from this slide is that had it been measured using your typical pre-post study, looking at whether or not people were better off or worse off after participating in the program, it would have concluded this was a smashing success. We doubled employment rates, when in fact the opposite was true. So this is why you need to have an equivalent control or comparison group. Now the researchers found similar patterns on pretty much all of the outcomes they measured. You see here with welfare receipt, big drop for the program group, that's the solid line, identical drop for the control group. They even saw it for the kids of the mothers who were participating in the program. So here you see the percentage of kids who are at risk on a number of different measures, whether academic, mental processing, or behavioral. And over the course of the program, you see that they all improved, pretty sizable improvements. There were less kids at risk at age 5 than at age 3 or age 2. But when you looked at the control group, represented by the red bars, they saw the exact same drop. So again, a pre-post studies would have said this program was really changing kids' lives, when in fact it really wasn't moving the needle at all. So the key thing to take away from this section, as you may have guessed, because I think speaking of beating a dead horse, is that you really need to have two groups. You need to have a program group that's getting the program and an equivalent control or comparison group to make sure that you have a real sense of what the impact of the program is. So this next slide here I'm going to skip. Again, I can come back to it if you're interested. It's another one of sort of these examples of how a comparison group study can sometimes get the wrong answer, and I'm happy to go over it if we have time. But I want to make sure I get to some concrete suggestions for building and using rigorous evidence of effectiveness. So I'm going to tie back all of my suggestions to the two main goals of evidence-based policy that I mentioned at the start of the presentation. So the first thing is you want to increase the number of programs and strategies that we have that are backed by strong evidence of effectiveness. And you do that through more rigorous evaluation. We learn more about what works and what doesn't. And then the second piece is to use the information from those evaluations and increasingly reward programs that have made the effort to build evidence of effectiveness. So to create funding incentives, maybe along the lines of the tiered funding initiatives that I mentioned earlier. So if you're developing an evaluation strategy or you're looking to build evidence of effectiveness in a given area, the first place to start is really you need to figure out what questions do you need to answer and what problems are you trying to solve. I think this is consistent with the presentations we heard earlier. So what problems would we most like to address, and how will we know if we've been successful? What information or knowledge are we missing that could help us operate more efficiently and achieve better outcomes? Really, an evaluation strategy is all about learning. It's not about sort of punishing people for doing the wrong thing. It's about learning what works. And so you have to figure out what it is you want to learn. And as part of that, as we heard this morning, you need to clearly identify how you're going to define success. What are the outcomes you're going to measure over time to see whether you're making an impact? And we suggest that whenever possible, the outcomes that you settle on should be concrete, measurable, and important. In other words, if these outcomes are improved, the lives of the people you're serving will meaningfully improve as well. So we're talking about things that any person reading a newspaper would see as important. Big boosts in reading achievement in elementary school, high school graduation rates, increases in earnings, reductions in violent crime, those sorts of big picture things, because that's really sort of the problems that we're trying to solve. So once you've identified the questions you want to answer and the problems you want to solve, the next step is to find out, well, what research has already been done on these questions? What's out there already? So are there existing programs or strategies designed to address these problems? And if so, what evidence is available to support their effectiveness? And a good first step in figuring that out is to go to some of these websites that I've listed here. These are websites that have done evidence reviews across a wide range of social policy areas and identified programs that produce important impacts on outcomes, sort of like the FAFSA example and the REA example I mentioned earlier. Full disclosure, those top two sites were ones that we developed at the Coalition for Evidence-Based Policy. We're very proud of them, but we also believe the other sites listed here are good resources as well for finding evidence-based programs. And so if you go to one of these sites and you find a program that really is effective in improving the outcomes you're trying to improve, that's great, because as I mentioned, most things that are rigorously evaluated turn out not to work when they're rigorously tested. So if you find something that did sort of stand up to a rigorous evaluation, you really increase your odds of improving outcomes. So at this stage, if you found something that's really effective, it probably makes sense to try to find ways within your program. Maybe it's a tiered funding initiative. Maybe it's a competitive preference in a grant competition. But some way to reward people who would faithfully adopt these evidence-based programs and put them into wider spread use. Now, you're probably not going to be able to address all of the problems you want to solve using existing evidence-based programs, since, as I've mentioned, the number of these programs right now is still relatively small. So in answering the questions that you want to answer, we'd suggest that you use some of your resources and attention and time focusing on efforts to build evidence, but to do so in a cost-effective way. And I want to be clear that this doesn't mean running out and trying to do a randomized controlled trial of everything you're funding. That's not an efficient use of resources or time. But instead, I'd suggest identifying a few, or maybe even just one, very promising candidate for a rigorous evaluation and see if you can get a good study underway. Ideally, a randomized trial if you can. As I mentioned, that gets you the most rigorous answer. And so when you're thinking through what to rigorously evaluate, what are good candidates? So the types of programs I've listed here are actually the same types of programs that we at the Foundation look for in our research competitions. If somebody's proposing a study, we want to see that they're studying something along these lines. So the first category of programs are those that are backed by promising prior evidence suggesting that they could produce a sizable impact. Now, this could be from sort of small-scale randomized trials, but it could be from comparison group studies or pre-post studies. Like I said, those designs are really useful for generating hypotheses about what might work. The second category of good things to potentially evaluate are programs that are widely implemented with significant taxpayer investment, but that have never been evaluated. Obviously, if you're putting a lot of resources into something, it would be good to know if it's effective. And then finally, one last category are low-cost programs that could easily be implemented on a large scale if found effective. So this is sort of a low-risk, potentially high-reward scenario. If you have a very low-cost intervention that you think could potentially have big impacts, even if you don't have any preliminary evidence on it, it might be worth testing it out because, if it fails, you're not really out, you haven't taken that much of a risk. But if it's successful, you could have a very cost-effective strategy. So I mentioned on the last slide that you should try to build evidence in a cost-effective way. And so I want to close out my presentation talking about what we believe is an underutilized tool sort of across the policy spectrum for building evidence. So there's a common objection out there for doing randomized control trials that they inevitably have to be very expensive. And that objection is not entirely misplaced. Traditionally, randomized trials have been very expensive. They've cost generally hundreds of thousands or millions of dollars. But the reason for those expenses isn't really sort of isolated to a randomized controlled trial. It's really true of any long-term study. And the biggest cost of those studies is data collection. If you have to go out into the field and find everybody in your study sample and interview them or test them or survey them, that's a very time and resource-intensive endeavor. And so it's by far the biggest cost of any study. So if instead of doing all of that, you can measure outcomes using administrative data that public agencies are already collecting for other purposes, you can take that big cost of data collection and reduce it down to a nominal amount, and the study can go forward at much lower cost. And as the quality and breadth of administrative databases have increased over time, the opportunities to do low-cost randomized trials has increased as well. This slide only just provides a few illustrative examples of the different kinds of outcomes that you can measure potentially through administrative data systems. And one other thing I want to point out about using administrative data to measure outcomes is it allows you to look at low cost to look at outcomes at all stages along the process. You don't have to wait 3 years and do a big survey at the end of the study to find out what worked. You could do a 6-month follow-up. You could do a 1-month follow-up. You could do a 2-year follow-up. And so you can sort of see the effects along the way because each follow-up doesn't really add much cost because you're just going back to the administrative database to measure the outcomes. So I've already given you a couple examples of where this has been done. The REA study I mentioned earlier was low cost because it measured all outcomes using unemployment insurance data, state unemployment insurance data. The FAFSA study was low cost because it used data from the National Student Clearinghouse, which is a national database that covers college enrollment at basically all post-secondary institutions across the country. And I want to give you one last concrete example of how this can be done and how you can really get a big payoff from a low-cost randomized trial potentially. So this was a study that was done in Illinois in 60 child welfare agencies. And it tested the effectiveness of a case management intervention that provided a recovery coach to substance-abusing parents who had temporarily lost custody of their children. So the coach helped the parents get help for their addiction issues, and the goal was to safely reunite them with their kids once they'd sort of resolved their addiction problems. So this study this program was tested in a study that randomly assigned about 3,000 substance-abusing parents either to receive a recovery coach or to a control group that received usual services. And then it tracked their outcomes using administrative foster care and child maltreatment data. And over a 3 to 5 year follow-up, the study found sizable, significant reductions in the time that it took to safely reunify parents with their kids and to close their foster care cases. And this resulted in big net savings to the state of about $2,400 per parent. And importantly, these savings came with no adverse effect on child welfare. There was no increase in child maltreatment. So because all outcomes were measured using administrative data, the entire cost of this study, even with a sample of 3,000 people tracked over a 3 to 5 year follow-up, was about $100,000. And so for the cost of $100,000, this program found that the study found an intervention that saved the state about $6.7 million just within the study sample alone. So $100,000 for the evaluation to find something that saves $6.7 million. So the key things that you have to have in place to do these kinds of study, I mentioned already, low-cost access to administrative data. Second, you need to have a sizable number of individuals or groups, like schools if you're doing an educational intervention potentially. You have to have a sizable number of these folks available to participate in the study without special recruitment. And so a common way that randomized trials go forward is in cases where you have an oversubscribed program, which is often the case. You have more people who could potentially be served by the program than you can actually serve. And so it's actually a fair way to allocate scarce program slots through random assignment, and that sets you up to do a rigorous evaluation. And finally, you just really need an approval of a key policy or program official to move forward with the randomized study. So like I said, our foundation is really sort of pushing the use of this approach. We have a competition every year to fund low-cost randomized controlled trials. And we believe that it's a way to really sort of rapidly build knowledge about what works, because we can't build knowledge fast enough using the really expensive studies of old alone. So we believe that if you use these studies, it provides the opportunity to really answer questions that are important to you, and you can do it without having to break the bank. So I'm going to close there. This is my contact information. Be happy to talk to you about any of this stuff, and happy to open up to any questions or comments that you have right now. Good.
So how do you, what is your advice for the dilemma where you have a program, you set up the randomized control trial, the program starts, and you realize that there are things that need to change in the program to make it more effective. And then, you know, you're sort of locked into this.
Right. Well, that's a really good question. It's something that I actually meant to touch on in here. One of the other sort of, I think, prerequisites for identifying a good candidate for a rigorous evaluation is first you want to make sure you have a well-defined program that you know can be implemented well. Because otherwise you face that exact scenario where you've got a study underway and you pretty much already know the answer that the study is going to come up with. If the program implementation is falling apart, you're not going to achieve impact on outcomes. So that's why you really want to be selective. Like I said, you don't want to run out and do rigorous evaluations of everything that you're doing. You want to find the really promising candidates that stand a good chance of being effective, because that's really what we're all looking for, is sort of the subset of programs that are out there that really are effective in moving the needle on these key outcomes. Does that help address your question? Yes, sir.
So that kind of raises an interesting question. So if we only study programs that can be easily evaluated, how do we really know? Isn't that in itself a selection process that's going on? Easily evaluated, we'll evaluate it. Not easily evaluated, we won't evaluate it yet. It could, in fact, be effective.
Right.
We just don't know because it's either too complicated or too costly to evaluate.
Right. I think that's a fair question. And so I'd say two things. First, even among the subset of programs that are easy to evaluate, a minuscule percentage of them have been rigorously evaluated. So even if we just tackled those and did rigorous evaluations, we would dramatically expand sort of the knowledge out there about what works in different areas. And so I think that's a key place to start. And I think especially if you're just getting started doing rigorous evaluations, you want to kind of pick the low-hanging fruit. Now, I would also say that there are definitely cases where you can't do a rigorous evaluation. There are some programs that just don't lend themselves to it. But we found in sort of our review of the literature that with some creative thinking, you often can come up with some good ideas for doing a rigorous evaluation, even in cases where you wouldn't think that they were possible. One example that comes to mind that came through our research competition was the state of Minnesota's Department of Human Services that manages their TANF program. They have a federal performance measure that they're subject to, which I'm told all of the states hate this federal performance measure. It requires tons of paperwork. They have to track down whether or not people are engaging in sort of job search activities. And it's just a lot of paperwork and tracking people down. And in Minnesota, apparently, it takes up about over half of their workers' time, just tracking down the stuff for this performance measure. So they wanted to see if they could switch to a different performance measure that could readily be accessed through administrative data. So instead of looking at these activities that people are engaging in, look at whether or not they actually got off the rolls, whether they got a job. And so they ended up setting up a randomized experiment, which they're still hoping to go forward with, where they randomly assigned some counties to be subject to this federal performance measure and some to this new state performance measure. And what they're going to see is, basically what they want to find out is, are we at least not having any adverse impact by doing this much simpler approach? And if we do, then we free up a ton of time for the people to actually help folks find jobs, as opposed to just sort of file paperwork. Is that?
So it looks like we're out of time.
Okay.
And I want to thank you, David. And I encourage you, if you do have questions, David's going to be available for a few minutes.
Yep.
If you want to come up and ask those questions. And we'll go from there. And then your resources, your contact information. And there actually are a lot of nice resources on the website.
Thank you. Thank you, everyone.